awesome in the summertime, hanging out with family and having fun, drinking, talking, laughing, and children run around the fire pit. You might want to think twice. Hello, my name is Nadjwah. I work at Stony Brook Hospital Burn Unit on level 8 as a certified nursing assistant. I'm here to discuss why social gathering and drinking around a fire pit can be dangerous. During the months of July through September, statistically, at Stony Brook Center, it's the #1 cause patients being evaluated in the emergency department. First, I'm going to talk about injuries associated with fire pit burns. Backyard fire pits have become more common. 5,300 burn injuries were results of having fire pits. Children under the age of 5 are burned from fire pit when abandoned. Accidentally, children fall into the fire pit due to parents being intoxicated, since they are not aware of the child's location, resulting in burns. The population base rate for fire pit burn injuries were highest for young children 5 years old. Fire pit injuries result to arm and legs, which cause long-term disabilities. Fire pit burns accounted for 3,000 patients admitted to the burn center over a 10-year period. 60% were 17 or younger. Outdoor fire pit causes injury through direct flame, burns, or contact with hot ashes or coal. Under the influence, adults attending to participate in risky behavior result in falling into the fire pit. Some examples of risky behaviors are pouring gasoline, lighter fluid, and pouring alcohol into the flames. It is advised to stop, drop, and roll. However, it's best to cut the clothes off and dial 911 immediately. Never use ice or cold water because it will restrict peripheral circulation and may decrease body temperature. Instead, cover the patient with a sheet or a blanket. Next, I will discuss the most common degree burns from contact within the fire pit. Second degree, it affects the outer layer of the skin. As you can see there, that's second degree. Third degree is more serious and you will need a skin graft. It's less red and more pink-white, as you can see. The next picture will also show a third degree burn. Here, this is a third degree burn. What you want to look for mainly is here, her neck, because her neck is where it's healed. As you can see, it's healed here, it's healed like on her shoulder blade. There's more white here, so the white area is going to take a little longer. Here's her skin graft. Here is very raw, it's very sensitive, so this is going to take longer as well. The next picture will show her healed healed with the burn. As you can see, this was her before. This is her before picture. Now here's her after. This is how she's going to look for the rest of her life, and she will need laser surgery. Finally, I will discuss how to treat a burn. So what you're going to do, the first thing you're going to do is wash the burn with ivory soap and water. The reason why we use ivory soap is because it has no dye, no perfume. Secondly, after you wash it with the ivory soap, you're going to put on bacentration, which is this ointment. Third, what you're going to do is put the zero form. This is a yellow strip that covers the burn. You always use these 3 products, always. And you can find these in your local stores, like CVS. Once you do all these 3 steps, you're going to then wrap the burn area with gauze. After you do all that, you're going to follow up with the doctor in 2 weeks. Look out for symptoms and signs of infection, more so a fever. Finally, I will end with this. Please do not have your children around a fire pit. And please, please, please do not drink around a fire pit. Thank you. Happy Nurses Week. Bye.